Hello, my name is Gary Hoffman, and I'm the founder of the Center for Vasculitis Care and Research here at the Cleveland Clinic and a professor of medicine at the Lerner College of Medicine. And we're here today with a patient and a good friend, David Hertz, to discuss with you the disease Takayasu's arteritis. Now, David, in many ways, is atypical for that disease, atypical in the sense that this is an illness that affects, in over 90% of cases, young women whose average age is about 26. It's very rare. It occurs in 1 to 2 patients per million newly diagnosed per year in the United States, perhaps a little more frequent in Asia. And its characteristics are inflammation of large blood vessels, like the main highway coming out of the heart that we call the aorta, and the branches of the aorta, with a particular propensity to affect those branches that go up the neck to the brain and out to the arms. In lesser frequency, the abdominal aorta is involved, and the branch vessels that go to the kidneys and the branch vessels off the abdominal aorta that go to the legs. Takayasu's arteritis is imminently treatable, but not curable. To be able to provide cure, you usually have to know cause, and we don't know cause yet. But we do have a number of therapies that can lead to improvement, and we hope generally high quality of life. David actually created for his doctors in 1987, 25 years ago, a conundrum of sorts, because he did not come to his doctors with blood vessel symptoms per se. And perhaps at this point, David, we can ask you actually what things were like in 1987 when you first became ill, and what was done at that time.
Well, I was 25, 26 years old, that time frame. And I had been an athlete. I was a swimmer in high school. I was a swimmer in college. And I was down in Boca Raton, Florida, working at my first job on a newspaper. And working out in good shape, and I started getting chest pain. And it was chest pain. It was also sharp stabbing pain in my left shoulder. And it was misdiagnosed for probably a couple months. And this would come and it would go, and I would take Advil or I would take an aspirin or something. I eventually saw a cardiologist who said, well, maybe we should take an echocardiogram. And by now, I was in considerable pain, shortness of breath. They took an echo, and I received a call that night telling me to go straight to the hospital. And by then, I was almost doubled over. I could hardly walk. Got to the hospital, and they gave me something for the pain, and I immediately went into shock because I was so weak. And I woke up, they were wheeling me into intensive care, cardiac intensive care, where I was for about 3 days, I would say. And they eventually had to do an emergency procedure where they, actually I was lying in the bed, and they had to make an incision in my chest and put a tube through this incision and tapped the pericardium. I was by then too weak to survive a surgery. And they drained 750 milliliters of fluid from around my heart. And that was the beginning of a very long road that eventually led me to you.
So pericarditis, which you're describing with a large accumulation of fluid around the heart, which we call a pericardial effusion, is so unusual for Takayasu's. We know it can occur, but it occurs very, very rarely. And no one would have guessed that ultimately the diagnosis of Takayasu would have been made in a young man. But you also illustrate another aspect of being a young, well-built athlete, is doctors tend to have some denial that anything serious can happen to you. So when you come to them with chest pain, they don't think about this being a serious heart problem. And so with Takayasu's, we often see very long delays in diagnosis. But in your case, it was reasonable to not jump immediately to the diagnosis of Takayasu's because you were not having large blood vessel symptoms. You were having pericardial symptoms. And so time passed, almost 8 years,
Right.
when you developed some additional symptoms which ultimately did lead to the diagnosis. Perhaps you can tell us something about those symptoms.
And during that time, I mean, you're absolutely right. I felt, when I was younger, like I was indestructible. I felt like it had to be a pulled muscle because what else could it be? And so eventually, after about 5 years, I was able to get off of prednisone. And I thought I was cured. And my diagnosis had been viral-induced pericarditis. And I had hoped that my health troubles were behind me. And I moved from Florida up to Cleveland. And I noticed that I started having a great deal of pain in my left leg and my left side when I walked, when I ran. And I thought, this is strange. Again, I'm young, I'm in good shape. I must be getting out of shape, and I must need to exercise more. And it came to the point where I couldn't walk more than a couple hundred yards without stopping because the pain became so bad. And that's when I started seeing a series of doctors trying to find out what was going on with my leg. And eventually, when we couldn't figure it out, I eventually got to you after a series of doctors in Akron and in Cleveland. And by then, I believe I was having pain in both legs and had been looking into this probably for about 2 years. And we started running tests. And eventually you said, this has to be Takayasu. And by then, I had iliac arteries severely compromised in both legs.
Yeah, so at that point, physicians are still reluctant to make the diagnosis of Takayasu's because most physicians have never seen a patient with Takayasu's. You know, when there's only 1 to 2 cases, new cases that come along per million people per year, a physician who has never seen it is likely not to even think of it. But the important clue is when someone then does a physical examination on someone who's having pain in their legs but not having symptoms of arthritis or bone disease, they may hear, if they listen carefully, over the abdomen or over the pulses in the groin for those blood vessels that go to the legs, they may hear the sound of turbulent flow, which we call a bruit, or they may find that when they try and feel your pulses in your legs that they're diminished. And as much as you being a highly trained athlete sort of turned the physician away from making the diagnosis of any serious and especially rare disease, you're compelled, once you hear that bruit or feel those decreased pulses, you're compelled to do a diagnostic study. And that study is, let's take a look at the blood vessels. So you, in the old days, we used to do an angiogram, which meant putting a catheter in the groin or in the neck, and then injecting dye into the blood vessels and looking at the anatomy of those blood vessels, seeing if some of them are abnormally enlarged, or more often in Takayasu's, far more often narrowed, creating decreased blood flow, leading to pain wherever that decreased blood flow is not getting to. And when you see multiple areas of narrowing, you begin to think along the lines of what acquired disease could this possibly be? And there aren't too many. And the differential diagnosis is very narrow. It's Takayasu's and Takayasu's and Takayasu's. But your pattern was so unusual because the predominant abnormalities were the abdomen and the iliac arteries that then led to the arteries that feed the legs, explaining why you were having pain in your legs with increased activity, because increased activity demands increased blood flow to be able to have those muscles function normally. So you're doing more activity. There isn't the increase in blood flow that would be normal, and this leads to what we call ischemia to the muscles in the legs and pain. Mm-hmm. But when we studied you, as we always do with angiograms, more recently in current times, magnetic resonance or MR angiograms, we also studied the entire aorta and all of the branch vessels, because we know that even if you're not having symptoms, you may have other abnormalities in those blood vessels that go to other areas that are an important measure of the impact of the disease to different parts of the anatomy. And so in your case, we did find, I think it was a left subclavian narrowing and a left vertebral narrowing. The left subclavian goes to the arm, and the left vertebral goes to the brain, one of 4 major blood vessels that go to the brain. And so having that roadmap of the disease, we know as we get sequential imaging studies of the entire vascular anatomy, we know what the roadmap is and how it may change. Even if you weren't having symptoms at all, if the roadmap was changing, it would tell us that our treatment wasn't particularly effective. Mm-hmm. So after the diagnosis was made, you find yourself back on prednisone again. Our most effective, consistently effective medication for the treatment of Takayasu's.
Right.
What was that like?
It was very discouraging. I can remember sitting and trying to tell my wife what this was like and what it would do to me, because when I was having an attack, you would put me on fairly significant doses, 60 milligrams a day for a month, which is no fun at all, but there was really no choice. So one of the things I learned after accepting the diagnosis is that you have to maintain a very even keel emotionally. You have to accept that your life will be limited in some ways, and you have to move on and maintain the best quality of life that you can. And so in my case, that was making sure that I continued to exercise as much as I could, that I continued to be a good father and a good husband, and that I continued with my career, and just had the patience to know that things were going to get better. And they eventually did, but we tried a number of medications, and I'm sure you remember them far better than I, but they each carried their own side effects, if you will, that and risks. And we eventually just had to stick with prednisone because the others were not nearly as effective as we learned through those tests that you described.
Yeah, and we've done many studies over the years to identify medications that would allow us to get excellent control of the disease, such good control that we would be able to decrease and eventually eliminate prednisone. But in many patients with Takayasu's, that hasn't come to pass. We often use combinations of medications attempting to get to the lowest effective dose of prednisone. And for many people, it works. But in your case, it was prednisone that worked. And as we added these new medications, we still were getting recurrent episodes of pericarditis.
That's right.
That was the signal event for you, even though it isn't the signal event for most other patients. And then in time, the area of narrowing in the abdominal aorta and the iliacs going to the legs, that got worse. Perhaps you can share that experience with us.
Well, it came to be that we figured out that the pericarditis was my canary in the coal mine. And actually, we were lucky because you mentioned it's hard to track Takayasu's until the damage is done. Mm-hmm. And that's when you're feeling severe leg pain or arm pain or headaches, things like that. So when I started feeling pericarditis, we very quickly jumped on it. Still, the narrowing continued in my the arteries heading into my legs, and my ability to function normally did continue to deteriorate to the point where walking up a hill was very painful. Doing exercise, and I got into martial arts, was very difficult to do. And yet we continued to do it, one, for the mental health aspects, but two, also to build up the collateral blood flow, with the thinking that other blood vessels would compensate for the main arteries that began to clog. But eventually it became so painful that I couldn't stand for more than a minute or two without pain, and I began to really forget what life was like without leg pain. And eventually we also, upon examination, had lost all the pulse in my feet. I had no discernible pulses by the time I got down to my feet.
Yeah, and thank you for raising a very important point. In people who have narrowing of some vessels, collaterals or side roads take on a bigger part of the role of carrying blood where it's needed. And while people may be having limited activity, capacity, because with repeated use, say, of the arms, they wind up getting discomfort because of inadequate blood flow, we are often not very quick to go to surgery to provide a bypass procedure, because in many people, those collaterals will develop over the ensuing year or 2 years or 3 years, and will get enough blood flow from those side roads so that surgery isn't even necessary. But in your case, because the main highway, the aorta, was narrowed and the iliacs were narrowed, you weren't able to develop those collateral circulatory pathways to compensate. So ultimately, this came to surgery. And
Right.
How many years ago was that?
That surgery was 8 years ago. 8 years ago, October 11th, I believe.
Yeah, and we remember that well because whether it was related to the surgery or not, you had a graft put in that went from the abdominal aorta to the open parts of blood flow supply that went to your legs.
Right.
But right after this surgery, you wound up having a flare-up of the Takayasu's that we had to treat with high-dose steroids again.
I think that was directly related. Whenever my body has a severe shock, I end up having some sort of flare-up. And so if I hadn't been so consumed with the surgery itself, I probably would have predicted it. But you're right, I did have, I emerged from the surgery with fever and pain, and you became aware very quickly that I was having a flare-up. The surgery itself was surprising in how drastic it had to be. We had discussed it for years, and you had prepared me well, I think, for the potential eventuality or even the probability that we would need to do surgery. But I thought that it would be a surgery that would bypass the arteries in my legs. And when we finally did another arteriogram and determined that my aorta was severely compromised, I think it was 80% closed by then, and I was a very sick man. The doctor told me that the surgeon told me that this was very serious, and that while he expected me to do well, that it was possible that I could die from the surgery. And that was a very sobering statement. I remember going back to work with that ringing in my ears.
In your early 40s?
In my early 40s with
a young family.
2 young kids. But my wife and I determined that if I was going to have any quality of life at all, if I was going to be able to have a life that was outside of a wheelchair, I needed to take the risk and to undergo the surgery. And Dr. Sarek, whom you directed me to, prepared me well, did a wonderful job. And I remember coming to in the intensive care unit after the surgery, and I had been on a ventilator for about 2 days. We had expected me to be on a ventilator for about 12 hours, but he wanted to be safe. I remember looking down at the incision, and the incision had to be in my side, right down here instead of here, because of the location of the inflammation of the aorta. And I was just amazed at how large the incision was. It was 13 inches. And above all else, there was nothing that would have prepared me for that shock. And that took an awful long time to get over. But in the end, we had no choice.
Right. So about half of all of our patients with Takayasu ultimately do require some surgery. In almost all of those patients, it dramatically improves their quality of life because it gives them back the blood flow that they needed and that they were deficient in not having because of the narrowing of the vessels that was involved. And so after getting over the flare-up, after getting over the surgical healing, how did that affect the quality of your life in the subsequent months and years right to the present time?
It was almost immediate. So I remember waking up and I had these X's on my feet. And my wife told me that was because the surgeons came in and immediately checked my pulses. And they said, oh, he's got pulses again in his feet. This was while I was on the ventilator and she was sitting there, and everyone was very happy that I had pulses in my feet, and eventually I was happy too. The pain in my legs was gone. And it was only then, as I was walking through the halls of the hospital in a great deal of pain from the incision, that I realized that I had forgotten what life was like to not have pain in my legs. And so as I healed, I found myself walking upstairs just for the sheer delight of walking upstairs without pain. And while the incision continues to cause me pain because of the vast amount of muscles that were cut and the nature of the incision, I feel better now at 50 than I did at 40, no question. My quality of life is greatly improved. I don't do martial arts anymore because I can't take blows to the stomach. That's a small price to pay to have the quality of life that I have now.
And so what kind of activities do you find yourself able to do that allow you to function without thinking that I'm a Takayasu's patient?
I'm still always aware because the incision is such that I feel it now, sitting here. I mean, I will always feel that incision. However, I garden. I do an awful lot of work in the yard. And before that was very painful and very difficult. And I would really struggle through it. I take hikes now. I swim. From my past as a swimmer, I swim now. I lift weights. And I'm just active with my kids. And I still walk those steps.
Well, that's wonderful, David. I think there are a lot of lessons to be learned from your ordeal with Takayasu's. One, that although this is a disease that predominantly affects women, men can be affected, usually young men, as you were, that the presentation doesn't have to be principally related to the large vessels. It can be somewhat atypical with nonspecific symptoms, or in your case, with pericarditis, which turned out to be, as you said, the canary in the coal mine for indicating flare-ups of disease. And that even when things seem to get horribly worse and you don't develop the collaterals that are so important to be able to compensate, and you have inadequate blood flow to maintain normal activities and quality of life, surgeries can be very effective, even though it can be a very rough go in getting through some of these very complicated surgeries. And you can then get back to perhaps not normality, but reasonably good quality of life and be a very productive, good citizen as you are. So thank you so much for coming in and sharing your experience with us. I think what we've recorded today will be highly educational for other patients with Takayasu's, and certainly give them hope that even if life isn't completely normal, it can be of high quality, and they can certainly stay in the game of life and not be on the bench for the rest of their time. So can't thank you enough for sharing that experience with us.
Thank you. My pleasure.